Tracking viruses around the world, which ones could become new problems here? Dr. Todd Ellerin, of course, Chief of Infectious Diseases at South Shore Health. We talk about bird flu. We talk about bird flu a lot. There have been no human-to-human interactions in the U.S. What's the risk in the other parts of the world?
Right. So bird flu is being seen in all parts of the world, mostly in animals, wild birds and other mammals, as you know. There have been about 800, 900 cases over the past 20 years. But more recently, they started in 1997 in Hong Kong. The mortality at that time was 50% in humans.
Wow.
But now fast forward, this past year, there's been about 67 cases in the United States, human cases. Fortunately, 66 were mild, one was fatal. So it looks like it's milder, but remember, Maria, these viruses can change, so we have to keep our eye on the ball, make sure we're surveilling and the research stays.
And we know that. So as you know, the U.S. announced this week it's withdrawing from the World Health Organization. Does that impact the amount of information that you're getting? I'm just curious about that.
Well, I think what's really important is that global health is critical. All right, we are interconnected.
Yep.
An example of that, January 20th, 5 years ago.
I know, I can't believe it
the
was 5
first
years
case
ago.
of COVID in the United States, right? That was a person that traveled to Wuhan and then came back, acquired COVID there, came back with it, and then within short order we had a pandemic. So I think what's important is that global health is U.S. health.
Right.
And the healthier the world is, the healthier the U.S. is. And of course, the U.S. is a global leader when it comes to science, when it comes to research,
right,
when it comes to surveillance and disease, prevention and, drug development and all of these things. So we have to keep that going.
What other viruses are out there besides the bird flu that could potentially pose a threat here?
Right. So one virus called polio, right? There was recently a case in 2022 in Rockland, New York, a case of paralytic polio. Again, a person who traveled abroad, acquired it abroad, and came back in the U.S. Now, the good news was there weren't additional cases. Why? Because our immunization program for polio is so strong. But if we back up to the 1950s, a reminder, there were 50,000 cases of polio a year, 25,000 cases of paralytic polio, mostly in children.
Wow.
We just don't want to go back there. So we have to make sure that we keep, everything we're doing, and we have to just keep our foot on that gas and not let up.
It's funny, that was 5 years ago, and that's how we got to know you, and we talked about COVID we talked about it every day. And look where we are now.
Right. And we know COVID, but most of us don't know polio. So when we don't know that, we can be scared and think that the vaccine that we're trying to prevent polio may be, more dangerous than the disease that it's trying to prevent. So we have to work on that.
All right. Dr. Todd Ellerin, thank you so much. We always appreciate it. Jennifer, to you.